Hi everyone, it's Tuesday. That means another episode of Health Happens. My name is Liz, and I am here with registered dietitian Christy Wolfson, and we are going to talk about the new food labels. Some of them have been rolling out, I noticed the other day in the grocery store, and so we're going to talk about the changes and what it means for you and how you can use these new changes to make better food choices. So, I think, Christy, for me, the biggest thing that I noticed right away is that now on the new food labels, and we've had a bit of technical difficulties before starting this, and so unfortunately we don't have the image to pull up for you to show you what the new food label looks like, but we will post that in the comments after we're done here. But the new food label, it has added sugars.
It does, yes.
And I'm super excited about that because I've been trying to be a little more conscious about how much added sugars are in my food, so let's talk about that a little bit.
Yeah, so there are quite a few changes that are rolling out with this new food label, and one of them is being added sugars. The old food label is about 25 years old, so it's definitely in need of some changes.
Yeah.
Yes, no updates have been made since 1993.
Wow, okay, we are overdue.
Yes, long overdue. So I think the first thing that stands out to people when they're looking at it, and we have kind of a rough draft, and we will post this in the comment section, so keep your eye out for that. But when you're first looking at it, what stands out is the calories and the serving sizes are much larger and they're in bold. So your eye is immediately drawn to those things. And serving sizes will also be updated to kind of reflect what Americans are actually eating, because taking a look now, it often doesn't reflect that.
I'm glad you bring that up, because I know for me, it was a long time before I noticed that my lunches, you get those frozen lunches at the grocery store, right? All of a sudden one day I was like, wait a minute, the serving size is half this container? Who eats just half a container? Even the whole thing doesn't really fill you up, I don't think, at least not for me. And I was kind of surprised. I was like, why would it, if you're buying this for your lunch, it's going to be your lunch, why wouldn't just the whole package be the serving size?
Right, and I think that's one area where in the past, maybe food companies got away with people thinking that their foods were lower calories, because you do buy those one meal items that you're going to eat in one serving. You might look at the back of the package, see, oh, there's only 250 calories in this, but the servings per container actually says 2. So with the new food label, and I'll hold this up just so everyone can see, you can see that the servings per container is listed above the serving size. So rather than just quickly looking at the small print serving size and moving on, your eye will be drawn first to how many servings are in that before you even look at the serving size. So, but with those updated serving sizes, those lunches, things like cans of soup, pints of ice cream, things like that, are all going to be labeled to what people are actually eating.
That's
so
good.
It's a true reflection of what we're putting into our mouths.
That's so good. So what else is new with the new food labels?
As I mentioned, the calories will be larger, so your eyes will be drawn right to that, and also the percent daily values have been updated. So I mentioned these haven't had any updates in almost 25 years, and our recommendations have evolved in that amount of time. So the daily values will reflect current guidelines rather than outdated guidelines. And also, the amounts, the nutrients down towards the bottom have been changed. So previously, the 4 nutrients you saw listed below calories and fat and carbs were vitamin A, vitamin C, iron, and calcium, and now vitamins A and C will be replaced with vitamin D and potassium as the nutrients of public health significance.
Okay.
And also the actual amounts of all of those nutrients are going to be included on there, where before it was just a daily value percentage. So we didn't actually know how many milligrams of calcium and vitamins were actually in our foods.
Okay, let's see, we got some comments coming in. I think Steve Steger is watching. Thank you. Okay, that's great. And somebody in Nebraska wishes they had a health fair there. Well, you know what? You should, if you're interested in starting a health fair, you should reach out to us. Maybe you could be the site leader for a health fair out there. Go to our website, 9healthfair.org, and you can learn more about how to do that. So I want to go back to the food labels, particularly the added sugar. And we should say that Some companies have gone ahead, they've rolled out the new food labels, but
Correct.
they have until 2021, right? All companies have until 2021, is that correct? Is that right?
They've pushed back, well, there's a proposed rule out there right now, hasn't been finalized, but pushed it back to, yes, 2021, I believe,
Okay.
of January.
So yeah, so you probably have, maybe you've noticed some of the new food labels, and then there are also plenty of products out there that don't. And going back again to the added sugar element, I find it really interesting. There's this day I was in the grocery store, and this was like right when I first started to become a little more conscious about how much added sugar was in my foods. And my husband's with me, and of course he's ready to like just get through this and get it done. And I'm staring at yogurt, right? And I'm looking at all these yogurts. And, you know, I think at the time he didn't think it was such a big deal, you know, my obsession with the added sugar. And I was like, I'm looking at one, and I'm like, do you think this yogurt really has 17 grams of sugar from strawberries? Or is there more in here, you know? And like that caught his attention. 17 grams of sugar in one of those little individual sized servings of yogurt. And so for me, I feel like this is where that will be a little, I mean, of course you can read the ingredients, right?
Right.
And
you could look at the ingredient list and determine if there is added sugar in there. The higher up on the ingredient list it is, the more you know is in there, but that still doesn't really tell you how much. And I think that's one of the best additions to this new food label is we can look at the total amount of sugar, but also how much of that total amount is actually added sugar. So now, hopefully you're seeing it already. If I'm sure a lot of yogurt brands are starting to go that way, because yogurt is one of those foods that it really gets you. You're not really
Right.
sure. So hopefully now comparing two yogurts in the grocery store, you'll be able to tell the difference. Keep your eye out for the fruit on the bottom yogurts and the flavored yogurts, because that tends to be where the most added sugar is added to those yogurt items.
Yeah, that's always so interesting to me because I'm like, it's fruit. Fruit is sugar. Why do I need more sugar?
Right. It's just especially Greek yogurts that have that more bitter taste to it.
It's their way of making
it's
it
their
taste better.
yeah, make it taste a little better.
I'm not
yeah.
a fan of Greek yogurt.
Yeah. Not
That would
everyone
be
is.
why.
So by putting a little sweetener in there, then you get added protein, but with that protein you get a little more sugar with it too.
All right, so you're a registered dietitian. What is not on the new food label that you would like to see, or what are some other changes you'd like to see come out with food labels?
So this is definitely a step in the right direction, but I do think the percent daily value is still something that's a little confusing to people. So if you know what it means, you can understand how to read it. And there is a little disclaimer at the bottom, which has been simplified to tell people what it is. And all it is how much of a nutrient that serving of food will give you if you're eating a 2,000 calorie diet. Only most of us aren't eating specifically a 2,000 calorie diet. Some of us are eating lower than that, and some of us need a lot more than that. So unless you truly understand what it is and how those nutrients are going to reflect in your diet, I think if there were a simpler way to tell people whether or not that food you're eating is a good source of a given nutrient, I don't know if that's a color coding system, maybe some pictures on there to help all literacy levels. That would just be an idea, because I think that is something that's kind of confusing, and it's just more math to do if you're not eating a 2,000 calorie diet.
Right. So looking at the new food label, and again, we'll post this in the comments after we're done, but what do you think is most important for people to pay attention to with the new food label that's going to help them make healthier choices?
It might sound kind of boring, but I try not to encourage people to focus on any one thing. And the reason for that is, we were talking a little bit before this, a lot of people right now are focusing on those added sugars. And that's great. I do think that's something that everyone should be paying attention to and limiting in the products that they're buying. But if you solely focus on limiting one item, you might actually be adding more of things like sodium and fat into your diet without realizing that. Sometimes we see companies will change their recipes a little bit to reduce the amount of added sugar, but then foods go up in sodium and fat. Something we saw in the 90s, low-fat diet craze, everything was reduced in fat, but a lot of those products went up in sugar and sodium. That's kind of where the products are today. So just focusing as a whole, paying attention to the portion size, and still paying attention to the sugars, that it's low in saturated fat, and if it's a great source of protein and whole grains, still read the ingredient label to make sure it's got good sources of nutrients in it.
Okay, so I'm going to throw something out there.
All right, let's do it.
This morning, this is what I had for my breakfast. It is a naked juice. Here we go. There's the front. So I'm going to ask Christy, how healthy is this? Is this, I bought it because it said no added sugar and 100% fruit juice. So this was my breakfast, is this healthy? Is this a healthy breakfast? Be honest.
All right. Well, it looks like it probably is 100% juice. It's got 35 grams of sugar, but no added sugar, meaning all that is coming from the juice or juice concentrate. I wouldn't say it's a well-rounded breakfast.
Okay.
I would probably suggest eating some protein with this. It'll
Okay.
hold you over a little more because this only has 1 gram. Let's see. No fat, 1 gram of protein, so it's pretty much all carbs.
Okay.
Which carbs aren't bad, but balancing out with some protein will help stabilize and make you feel full a little bit longer.
Okay. All right, so have this with something.
Have it with something.
So it's
would be my
permission to
suggestion.
eat more, which I like
Yes.
that.
I would agree with that.
Awesome. Well, thank you
Yeah.
very much. And Christy and I, we work together on a blog, and it's very specific. It's about the added sugar component, and in this blog we talk about carbohydrates and starches and where they fit in with the whole sugar element. So if you're curious about the added sugar section of the food labels and cutting back on the sugar that's in your diet, we'll post that blog as well when this Facebook Live is done, which we're about to wrap up here. So definitely look out for that. And Christy, I want to say thank you so much for joining us.
Thank you for having me.
This has
I
been,
enjoyed it.
Yeah, this has been very informative. So I feel like I'm ready to go out there and make some good choices.
Yeah, everyone's going to be reading the labels in the grocery store
Yes.
after this.
Yes, I hope so. All right, well, thank you. Thank you guys for joining us today. And next week, we hope to have our Find a Fair page up and running, hopefully by the end of this week. So next week on our Facebook Live, we're going to be talking about some of our health screenings, particularly those that can detect cancer. Early detection is definitely key, so we want to talk a little bit about those. So I hope you can join us next week, Tuesday at 11. We'll see you then. Thanks for joining us.
Thank you.